practitioner today. I'm going to be doing a head-to-toe assessment. Can you please tell me your name?
Sure, my name is Stephanie Smith.
And when's your birthday?
12/19/1979.
Okay, so I have Miss Smith, who is healthy appearing. She looks pretty fit. She is well dressed for this season today. Her skin is cool and dry. Turker is pretty elastic. Nails are well groomed, kept short, no clubbing or cyanosis noted. Cap refill is brisk. I'm going to do an assessment now, I'm sorry, Ms. Smith, on your head to toe. If you have any questions throughout, just ask me. Let me go rewash my hands because I itched my nose. I'm going to start from your head. Hair is evenly distributed. It is clean and dry. I'm going to put on some gloves and palpate a little bit. Look around. No flakes. No redness. Cranium is normocephalic. Take off the gloves. Off my hands. Face is pretty symmetrical. Eyebrows are even. Eyes are even as well. I'm going to just pull your eyes down, look at your sclera, which is white. Conjunctiva is pink and moist. Ms. Smith, have you had any vision changes recently?
Mm-mm.
I'm going to test your vision using the Romberg and Snellen chart. Which turns out she has 20/20 visual acuity. So now I'm going to get a pen light and just check out your pupils. Okay, so if you can just look at my nose. I'm going to start with one eye and look at the other. Pupils are equal, round, and reactive to light. They are 3 millimeters constricted down to 2 millimeters. Can you look at the poster behind me and look back at my pen? Look at that poster. Look at my pen. Pupils are equally accommodating and they react consensually. Sorry, I'll do it again. Okay, good job. Okay, so now I just need you to follow my pen. I'm going to start up here. Go to your nose. Okay, good job. And then I want to test some cranial nerves. So I'm just going to rub this along the side of your face. You feel that okay?
Yep. Yep.
Any pain or discomfort? Okay. I want to open up your jaw and close. No clicking or crepitus noted to the jaw. I want to go back to her ears, which are equal and symmetrical. No growths, no redness noted. I'm just going to palpate a little bit. Let me know if you have any tenderness to the tragus, auricle, and posteriorly. Nose is symmetrical. I'm just going to palpate her maxillary sinuses, frontal sinuses. Any pain or tenderness? Okay, I just want to test your breathing. So I'm going to occlude one of your nares and then take a big breath in. Good job. Another nare? Any difficulty? So no nasal occlusion or deviated septum. Can you scrunch your eyebrows? Go really scared? Okay, give me a nice smile. Face is symmetrical. Show me those teeth again. Teeth are white, intact. Can you open up your mouth? Oral mucosa is pink and moist. Can you stick out the tongue? Tongue is midline. Stick out your tongue and say ah. I'm going to test your gag reflex. Okay. Neck is supple. No palpations. Nodules or masses noted. Trachea is symmetrical and midline. I'm going to check one carotid artery at a time. Palpation first. Good and strong. Good and strong, no thrill. I just need to take a second to listen. Like that. Good job. No bruise noted. Have you noted any vision changes recently?
No.
Any changes in your hearing?
No.
Okay, so I just need to do a quick hearing test to you.
Okay.
So I'm going to kind of close one ear and just whisper a little phrase in your other, and you just have to repeat it back to me.
Okay. C3B.
Okay, good job. Do your other ear.
A2C.
Good job. I'm just going to palpate some lymph nodes. If you feel any tenderness, let me know.
Okay.
I'm going to do preauricle, posterior auricle, occipital, tonsillar, superficial clavicle, no, superficial cervical, deep chain cervical, and supraclavicular. And posterior cervical, if I might have skipped that one. Any tenderness?
No.
So no tenderness, no lymph node enlargement. Working down, I'm just going to check out her chest and her rate of breathing. Her chest is symmetrical. Breathing is unlabored and even. There is no accessory muscle or retractions noted. Okay, Ms. Smith, I'm going to just kind of step behind you and check out your chest a little bit. I'm going to first start with palpations. Do you feel any tenderness anywhere?
No.
Shoulders are symmetrical. Chest is normal shape, no abnormalities noted. I'm going to palpate along or percuss along this costovertebral angle. Let me know if you have any pain.
Sure.
Any there?
No. No
Any
pain.
there? Okay. I'm going to take a minute to just listen to your lung sounds. I'm going to start up here and listen in a pattern of left to right, down to down. For the sake of time, I'm going to go fast. Take a big breath for me. Good job. And down to 2, and 2, 3, and 3, 4, 4, 5, and 5. Okay, I'm going to listen laterally. Can you take some big breaths at 6? Good job. 6 over here. 7, and 7 again. Now adventitious breath sounds noted. Lungs are clear bilaterally. I'm going to come to the front. It's good to note that the cornea is located at the 4th intercostal space. The right middle lobe is located between the 4th and 5th rib. And the apices of the lungs are located on the supraclavicular. So now I want to look at your heart and your cardiovascular a little bit. So I'm going to palpate the precordium to find the strongest apex of your heart. Thank you for leaning back. No thrills or heaves noted. But the PMI is located mid-clavicular in the 5th intercostal space. So then I'm going to go ahead and listen to her heart tones with the diaphragm of my stethoscope. And then I would spend time doing the same motions through, but using the bell of my stethoscope. Okay, so Miss Smith, I'm going to have you lay down now. And I'm going to have you just kind of lean over to your left side so I can just take a better listen at that heart once it's pressed up against. Okay, S1 and S2 is heard. No murmurs or abnormal tones noted. I'm going to go ahead and check her radial pulses, her brachial pulses, her pulpiteal, dorsalis putalis, and posterior tibial. Pulses are all strong and equal and palpable. I'm going to just inspect her stomach, which is flat, no distension, it's symmetrical. I'm going to start by listening to the 4 quadrants. making sure I hear vowel sounds in each quadrant, and I do, and they are normoactive. Then I'm going to switch over to my bell and listen to that aorta. Renal arteries. Iliac arteries. And no bruits are noted. After auscultation, you're going to go ahead and lightly palpate the quadrants. Ms. Smith, if you notice any pain or tenderness, please let me know. No retraction away from my light palpation. I'm going to go a little deeper now. No masses or tenderness or pain noted. So this next one is a little uncomfortable. I wanted to see if I can palpate your liver, so I want you to take a big, deep breath in. Okay. Liver edge is smooth and soft. Liver is not enlarged. Unable to palpate the spleen or kidneys. I'm going to go ahead and work my way down to your legs and check out some strength while I have you down, okay?
Okay.
So we're going to start with this leg. I will do the assessments to both legs, but for the sake of this assessment, I'm just going to do it to one. So I want you to bend your hip all the way up to your stomach. Good job. And then drop it over the side of the table. Any pain with that?
No.
It's a good flexion and extension. So I want to move the hip bone around. I want to externally and internally rotate it. Any pain with that?
No.
Okay, so then I'm going to bring it out. Abduct and then adduct in. Any pain with that?
No.
Okay. Ms. Smith, I want you to bring your leg up. Good. Push your leg down. Nice and strong. This knee. Can you bend your knee for me?
Yep.
Push your knee down. Good job. Now bring your knee back up. Okay, knee is nice and strong. Ankle. I'm going to inverse and everse it. And the same with the foot. Any tenderness or pain?
No.
Okay. Can you point your toes down for me? Good pushes and toes up. Okay, so pushes and pulls are equal bilaterally. No abnormal joints, inflammation, or pain noted to any of the sites. So we're almost done, Ms. Smith. If you could sit on the side of the table for me. Okay. I'm going to give you 3 words. I'm going to give you a globe, a cup, and a pencil.
Okay.
If you can remember those 3 words, and I want you to tell them to me at the end.
Okay.
Can you tell them to me now, though?
Globe, cup, pencil.
Okay. So now I want to have you touch my finger and touch your nose.
Okay.
And just follow it around. Good job. Can you do that with your next hand? Good job. Okay. Can you tap your fingers really fast? Okay. And then I want to pat your knees, but alternate palms up and palms down. Okay. No abdominalities there. I want to test your neck strength.
Okay.
So can you flex your neck down, extend your neck back. Good job. Now look left, look right. Bring your ear down to your shoulder. Other ear. Good job. Now push against my hand. You do that the other way. Any pain with that?
No.
Okay. So let's check out those shoulders. Can you stand up for me?
Sure.
We are going to reach out in front of us. Bring your shoulders back. Good job. So we're going to go out to our sides and give yourself a big hug. Okay, so bring your arms back behind you. Touch your elbows. Arms out to the side and rotate. Any pain with any of those movements?
No.
So flexion, extension, internal, external, abduction, and adduction, or normal with the shoulders. Okay, wrist out. Wrist down, wrist up. So then rotate inwards. So no radial deviation and outward coronal deviation, which is all normal. Fingers grip tightly. Okay, spin those fingers out. Now can you open and close them?
Mm-hmm.
Good job. I want to test your strength in your hands. Good job. Okay, don't let me move your arms.
Okay.
Don't let me move your arms.
Okay.
Can you bend your elbows?
Yep.
Extend extend them.
Yep.
Good, you got your palms down, and palms up. Okay, arms back. Pull me towards you. Pull. Push me away. Good job. Arms are nice and strong. I want you to stand here, but close your eyes for 20 seconds. No gait disturbance. 20 seconds is up. Good job. Okay. I want to see if you have any sensory deficits.
Okay.
So I'm just going to have you close your eyes, and I want you to tell me if I'm touching left, right, or both sides.
Okay. Left. Right. Left, right.
Good job. So now if you can take a couple steps for me.
Sure.
Just watch how you're walking. No problem there. When you walk back to me, can you do heel toe?
Yes.
Good job, Miss Smith. Do you remember those 3 words that I gave you?
Globe, cup, and pencil.
Okay. So now we are almost done. The last thing I need to do is to check your spine.
Okay.
So if you can just reach down and touch your toes. I'm just going to palpate along your vertebral column. And notice that it's nice and straight. There's no curvature and no bony prominences. Can you come back up for me, but take your time? So I want you to extend back. Good job. So go over to your side. So bring your right hand down to your right foot. Okay. Left other side. And then can you just twist at the belly?
Mm-hmm.
Good job. Any pain with any of those movements?
No, none at all.
Okay. Do you have any questions for me?
No.
Okay. Well, it was nice to meet you. Thank you.
Thank you very much.